Okay, guys, I have discussion D for you. Now, the title is Where Older Residents Outnumber Services. Okay, so we're going to dig into that tonight for D. Please join me for Where Older Residents Outnumber Services for tonight's discussion D. Here we go. The headline, Where Older Residents Outnumber Services, captures a structural imbalance. The article documents across multiple retirement destinations, communities where the population of older adults has grown so large and so quickly that the systems meant to support them or meant to support aging populations can't keep up. The page walks through a dozen cities and retirement hubs where warm weather, recreation, and lifestyle amenities have drawn tens of thousands of retirees, but healthcare capacity, transportation networks, and home-based supports have expanded far more slowly. Okay. The results is a widening gap between what older residents need and what local infrastructure can deliver. How the page supports that meaning. The article builds its own case through short, place specific portraits that repeat the same pattern in different geographies. High concentration of older adults, often 30 to 60% of the population, create unusually intense demand for medical care, mobility, supports, and daily living services. Healthcare systems lag behind population growth, with too few hospitals, limited geriatric specialists, and long wait times for appointments. Transportation is consistently thin, especially in suburban or master planned communities where driving is the default. Home health agencies and volunteer programs are overextended, leaving many older adults to navigate gaps on their own. Across California, Florida, Arizona, and North Carolina, the article shows how climate-driven migration and retirement oriented development have outplaced the slower, costlier expansion of essential services. Concrete examples the page gives. Several locations illustrate the mismatch vividly. Bonita Springs, Florida. Roughly 40% of residents are over 65. Hospitals and clinics are limited, and many must travel to Fort Myers or Naples for specialists. Public transit is minimal, and home health services are often oversubscribed. Green Valley, Arizona. About 60% of residents are over 65. One of the highest concentrations on the list. Healthcare facilities are sparse, and most specialty or hospital care requires a trip to Tucson. Mobility is difficult for non-drivers. Sarasota and Naples, Florida. Both have large retiree populations, 30 to 35%. Despite wealth and amenities, geriatric care, long-term care, and transportation options are stretched thin, with long waits and limited accessibility. The Villages, Florida. One of the largest retirement communities in the country. Social life is abundant, but emergency response, hospital access, and transportation outside the community can be strained due to sheer volume of older residents. These examples show that the issue isn't isolated. It's systematic across many high-growth retirement destinations. Why this pattern matters. The consequences ripple across individual well-being, family caregiving, and community planning. Access to care. High demand leads to long waits, limited appointment availability, and frequent travel for specialty or urgent care. Mobility and independence. Sparse public transit and car-dependent layouts make daily tasks difficult for older adults who no longer drive. strain on informal supports, volunteer neighbors, volunteers, neighbors, and family caregivers fill gaps, but the scale of need often exceeds what informal networks can sustain. Equity and planning challenges. Even affluent communities like Naples or the villages experience shortages, showing that wealth alone doesn't guarantee adequate service capacity. Aging in place risks. Without adequate services, the promise of aging in place becomes precious, especially for those with chronic conditions or limited mobility. These pressures highlight a national trend. Retirement migration is accelerating faster than the systems designed to support aging populations. Practical levers, the article implies, and their trade offs. While the article doesn't prescribe solutions directly, its examples point towards several policy and planning levers. Expanding medical capacity, more clinics, geriatric specialists, urgent care centers, and telehealth infrastructure could reduce travel burdens, but require sustained investment in workforce recruitment. Improving mobility options, public transit, senior shuttles, paratransit, and subsidized ride services can help non-drivers. Though they demand ongoing funding and coordination. Strengthening home-based services, scaling home health, personal care and grocery delivery, and medication management services supports independence but depends on labor availability and reimbursement models. Coordinating volunteer and nonprofit efforts. These networks are valuable stopgaps, but they cannot replace systematic infrastructure. Relying on them too heavily risks burnout and inequity. Reimbursing land use and community design, walkability, mixed use development, and accessible housing can reduce dependence on cars, but require long-term planning and zoning changes. Each lever addresses part of the gap, but none alone solves the underlying demographic imbalance. Key takeaway. The headline points to recruiting mismatch, retirement friendly climates, and amenities attract older adults in large numbers, but municipal services, healthcare systems, and transportation networks expand far more slowly. The result is predictable and widespread communities where older residents dramatically outnumber the services they rely on, creating daily challenges for access, mobility, and caregiving. Okay, guys. The second part of this is seniors will soon outnumber children, but the US isn't ready. Okay, so that's the second part of tonight's C. Signals a major demographic turning point within the next decade. The population age 65 and older will exceed the population under 18, and the article argues that American systems, healthcare, long-term care, workforce, and community infrastructure are not scaled or organized to meet that shift. The data the page uses to make the point, timing and scale, census projections cited in the piece show that by about 2035 there will be give me 1 second, roughly 78 million people 65 plus versus about 76 million under 18. Recent trends. More recent census estimate confirm the aging trajectory. The 65 plus share has been rising while the under 18 share has fallen, producing states and many counties where older adults already outnumber children. How the article explains not ready. The page lays out several concrete shortfalls that make the US poorly prepared. Workforce shortages, too few clinicians, social service professionals are trained in geriatrics and long-term care roles, so demand outstrips available expertise. Healthcare system capacity, hospitals, specialists, and community-based care, home health, hospice, geriatric clinics are unevenly distributed and often, God, this is long. Give me 1 second. Inaccessible without long travel or long waits. Long-term care and home supports. The supply of affordable quality long-term care and paid caregivers is limited. Informal family caregiving is strained as fewer work-age adults are available per retiree. Fiscal and program stress. Social Security, Medicare, Medicaid face sustainability and capacity pressures as the ratio of workers to retirees falls. Okay, real world consequences. The article highlights longer waits and travel for care, especially in rural and fast aging Sunbelt communities. Greater reliance on unpaid family caregivers, increasing economic and emotional strain on households, higher risk of social isolation, unmet daily living needs for older adults who lack transportation or home supports. Policy and planning levers. The page implies with trade-offs. Grow and retain workforce. The workforce. Expand geriatrics. Training caregivers. Wages and recruitment trade-off. Require sustained public and private investment. Scale community-based care and telehealth. Invest in home-based services and remote care to reduce hospital dependency trade-offs, uneven broadband, and reimbursement rules limit reach. Redesign communities for aging, more accessible housing, transit, and mixed use neighborhoods. Reduce dependence on cars. Trade-offs. Zoning and development changes are slow and politically fought. Strengthen programs. Sovereignty. Reform financing or social security Medicare to match demographic realities. Trade-off. Politically difficult and distributionally sensitive. Okay, guys, here's the key takeaway. Key takeaway. The headline summarizes a clear evidence-based trend. The U.S. is moving into older demographic era faster than its health, social, and fiscal systems can adapt, producing predictable gaps in care, support, and community design. All right, so that is it for tonight. I will see everybody sometime this weekend for one show, or Monday. For now, Gator Wellness. Take care, folks.